First, I want to provide a quick update on PPE. As of yesterday, we've delivered over 5.3 million pieces of PPE, and that includes masks, gloves, gowns, and other items the Command Center has provided to hospitals, nursing homes, other facilities on the front lines, and first responders and emergency management personnel. Our Command Center is in communication daily with hospitals and medical professionals around the Commonwealth to monitor the capacity in our hospitals. As of yesterday, there were 3,872 patients hospitalized statewide for COVID-19. That includes a little over 80 new hospitalizations for COVID-19. 9% of all the COVID-19 positive tests we've done are currently hospitalized. Out of the 18,000 available hospital beds statewide, ranging from ICU beds to field hospital beds, 56% of those beds are unoccupied and available for patients. The Commonwealth's healthcare system is an incredible collection of people and organizations. In just a few weeks, it's mobilized to dramatically increase capacity, including 5 new field hospitals. We'll continue to monitor the rate of hospitalizations to ensure there's enough staff and space to respond to the surge. But as a reminder, if you have symptoms, if you feel sick, if you have a chronic medical condition, please reach out and contact your healthcare provider. And as I said yesterday, you can always use Bowie Health's online symptom checker to connect with telemedicine options and others if deemed appropriate and necessary. That's available at bowie.com/mass or at mass.gov/COVID-19. So far, Bowie's connected with 83,000 individuals here in the Commonwealth of Mass and has recommended direct connections to a clinician in many cases to engage in a telehealth visit, and in some cases has encouraged people based on their symptoms to call 911. We cannot emphasize how important it is for people to recognize and understand that the healthcare system is fully optional and fully functional, and we did a ton of work to make it possible for people who have ongoing medical conditions to be able to get the services and the treatments that they need, while at the same time be able to deal with the surge and all the issues associated with managing COVID-19. I want to give a quick update here on testing. Yesterday, the Commonwealth conducted nearly 6,000 new tests, which brings our total tests statewide to about 175,000. The state reported 1,556 new cases of COVID-19 for a total of just over 41,000 positive cases. The last few days, we've seen fewer or about the same number of positive cases day to day, but we think it's too soon to draw a conclusion from that data. First, a few days does not represent a trend. We've seen this data bounce around before. And secondly, the number of positive tests is entirely dependent on who you test. And what I mean by that is daily positive test totals don't necessarily represent what's happening across the entire Commonwealth. Today's announcement on increased testing should help expand the universe of testing, and in many ways will be one more element of how we think about hotspots and opportunities to engage and to intervene. The piece of data we watch most closely is the number of hospitalizations for COVID-19. And we're still seeing an increase, a modest one, but an increase there statewide. Since the end of February, we've increased testing capacity dramatically through the State Public Health Lab and a wide range of lab partners at academic medical centers, commercial labs, the Broad Institute, and others. We now have more than 30 partners that are testing each day. Massachusetts remains a national leader in per capita testing, and we're continuing and committed to building on this work. Part of our statewide monitoring focuses on hotspots or high-density areas where the virus can spread quickly. And we've worked with local partners to address testing needs in several of these high-density areas. In Chelsea, Massachusetts General Hospital worked to quadruple testing capacity and to provide testing in housing developments. The Commonwealth, through the National Guard, also did mobile testing in Chelsea as well. In Lowell, we worked with CVS and the federal government to stand up a rapid testing pilot with the ability to test up to 1,000 individuals a day. The National Guard and Fallon EMS continue to test patients and staff at state hospitals, long-term care facilities, assisted living facilities, and 24/7 congregate care programs here in Massachusetts. And prioritized testing is also available for our first responders, healthcare workers, and grocery store workers in Lowell, in Springfield, and Foxborough. Today we're going to expand those efforts at several more locations across the Commonwealth. In partnership with Quest Diagnostics and the Mass League of Community Health Centers, we will dramatically increase testing at several key community health centers here in the Commonwealth. As everybody knows, community health centers provide comprehensive health services for people across the Commonwealth. And these facilities are also deeply rooted in the fabric of their local communities. They're trusted partners in addressing the broad health needs of underserved populations. And they're committed to eliminating health disparities and facilitating access to health care for those they serve. Working with the Mass League, we've identified community health centers who have the capacity to ramp up testing in needs in areas of high need. This includes many densely populated communities. Quest has agreed to ship 2,200 tests per day to 12 community health centers and is committed to adding more soon. The first group of health centers includes facilities and operations in Quincy, Brockton, Lowell, Fall River, New Bedford, Worcester, Provincetown, and multiple sites in Boston. The Boston locations are Dot Health, East Boston Community Health Center, Codman Square Health Center, and the Whittier Street Health Center. Harbor Health Services will also have multiple sites coming online. People interested in being tested should contact these health centers this week. Each location is processing appointments differently. Soon you'll hear more about this from Manny Lopes, who's the CEO of East Boston Community Health Center. His community health center has already received 900 tests, and that number will continue to grow. I do want to say, Manny, how much we appreciate the work and the partnership that you and the folks at your organization have provided to us on numerous occasions over the course of the past 5 years. And we're very grateful to have you and your team step up to participate with us jointly in this particular initiative. This increased testing capacity is one crucial part of our response. Another key piece is community tracing. Massachusetts is the first state in the nation to launch a statewide community tracing collaborative to better track positive COVID-19 cases. Here, too, community health centers have an important role to play due to the deep connections with the cities and towns in which they operate. To date, more than 30 community health centers are participating in the Community Tracing Collaborative, working with us to trace contacts in the neighborhoods and the cities and towns that they know so well. By joining us in this program, some centers have even been able to bring back some furloughed staff, which is great news for everyone, as having experienced local staff working on the tracing initiative makes a big difference. And we're always glad to get people back to work, especially during these tough economic times. Over time, tracing is critical to helping us understand the spread of the virus and helping us return to the new normal. Integrating community health centers in our response and ongoing discussions is also an important part of that focus. And as a reminder, we need everybody out there to participate in this tracing program. We've been working with cell phone service providers to make sure that when our tracers make calls, they show up as MA COVID team and are not blocked by caller ID. Please pick up if you get that call. This is your opportunity to help stop the spread of COVID-19, especially perhaps in your house, apartment, or neighborhood. In closing, I know yesterday's news with respect to schools will remain closed throughout the year was yet another sign of how this virus has dramatically reshaped in so many ways our lives and our daily chores, rituals, and all the rest. Schools and businesses are being closed, people are staying home, and people are wearing masks. All a really good thing. But along the way, we're not being able to see loved ones in person, and it's disruptive and disturbing. I think everybody would like to see us find a way to get back into something that looks more like what people used to do day in and day out. But for Massachusetts, which is now a national hotspot for COVID-19 infections, we really do need to stay the course and keep up our efforts to stay home, socially distance, wear a mask, and respect and understand the issues associated with this virus. If we move too quickly, we risk losing the progress that we've made so far. And our healthcare workers in our hospitals, which have been working hard on our behalf, are pushing back against the virus, and they need us to push back too. We owe it to them, and we owe it to our parents and our friends and our neighbors to keep up the fight and to win. We'll get through this, and I believe we will come out stronger on the other side. But everybody needs to do their part and understand that we need the facts on the ground to drive a lot of our decision making.